I know that hearing bad news every day is really hard, and I hate starting my part of this broadcast every day with it, but it's imperative that Hoosiers understand the gravity which we're facing right now with COVID-19 across our state. Today, we unfortunately reached a milestone and surpassed 100 deaths from COVID-19 in our state. As we reported this number this morning, 24 Hoosiers have died from COVID-19. That is the highest number of deaths reported to date in a 24-hour period and reflects individuals who died between March 29th to April 2nd. This sadly brings the total number of lives lost in Indiana to this pandemic to 102. I had my team calculate what is truly a very crude mortality rate, which at the time is basically 2.9%, with the best data that we have available. What I want to make sure that you understand is that in Indiana, we have really done targeted testing only for our highest risk population, oftentimes really those individuals that were hospitalized. Those 80% of individuals that were sick, we just asked you to stay home and we didn't test. So consequently, this number is going to be much higher than the real mortality rate. We continue to hear that many of our patients who die of COVID-19 also have multiple underlying medical conditions such as heart disease, lung disease, or diabetes. Unfortunately, Indiana has a higher proportion of individuals who have these conditions as compared to other states, which makes obviously those individuals more likely to have severe illness or death from COVID-19. But as you can see, we're also seeing deaths occur even in some younger individuals, and that's why it is so important that we take these special precautions and stay home and social distance and reduce the risk that you will contract this disease or spread this disease in our state, in your family, in your community. As I've promised, we've added more data to our dashboard to better show not just the number of positive cases and deaths, but also the number of people who have been tested in each county across the state. While the percentages of those testing positive in some counties are higher than in others, it's important to remember that we continue to do targeted testing of those individuals who are at higher risk. I know this is a time when we're traditionally thinking about spring break, Easter gatherings, but I want Hoosiers to continue to take social distancing seriously. These are not normal times, and we cannot act as if they are. I know it's hard to think about missing a family gathering, but the best thing we can do to protect our loved ones is to follow the guidelines and flatten this curve as quickly as possible. The best way to keep from overwhelming our hospitals and our healthcare system is to keep people healthy. And we're still planning for when our healthcare system will experience the peak of that surge of COVID-19 patients.